Importance of infection prevention for healthcare workers. We know that one of the greatest threats to the medical professionals, their patients, and the public at large is the failure to properly control the spread of infection in clinical settings. Infection prevention and control is a scientific approach and practical solution created to stop the harm that infection related harm can do to patients and healthcare professionals. Since it is pertinent to both patients and healthcare professionals at every single interaction. Infection prevention and control holds a special place in the fields of patient safety and high quality universal healthcare. This practice can limit disease transmission and occupational exposures when implemented consistently and correctly. One important aspect of nursing practice is the proper use of infection prevention procedures. Failure to practice currently and consistently can result in occupational exposures or disease transmission. Infection prevention and control measures are everyone's responsibility. The role of healthcare providers is to ensure safe and effective infection prevention and control practices are upheld. Evidence-based best practice guidelines are implemented and continued competency in institutional policies are maintained. All healthcare providers are required to apply infection prevention and control measures when providing care to clients. It is important to educate and support clients as well as their visitors about infection prevention and control practices and how to prevent healthcare associated infection. Continually updating your infection prevention and control knowledge and skills is essential to reduce the spread of infection, role model positive health promotion, and reduce health challenges or inequities clients encounter related to infection prevention and control. As essential role of healthcare providers is to ensure effective infection prevention and control strategies are in place to identify, analyze, assess, and manage any potential risk, thereby to advocate for the safety of clients, the healthcare team, and the healthcare environment. Both regulated and unregulated healthcare providers must follow infection prevention and control standards, guidelines, and best practices. As healthcare providers, it is our role to maintain competency in infection prevention and control practices by staying up to date on new policies and changes in practice. It is also our role to support our colleagues to maintain competency by reinforcing proper practice and sharing knowledge with peers of policies changes. Infections associated with the provision of healthcare affect patients, consumers, and the workforce and can cause considerable harm and may increase the risk of morbidity and health death. increase the use of health services, for example, extended length of stay, resulting in increased use of health resources such as inpatient beds, treatment options, and investigations, place greater demands on the health workers. Every year, lives are lost because of the spread of infection in hospitals. Healthcare workers can take steps to prevent the spread of infection disease. These steps are part of infection control. Proper hand washing is the most effective way to prevent the spread of infection in hospitals. If you are a patient, don't be afraid to remind friends, family, and healthcare providers to wash their hands before getting close to you. Other steps healthcare workers can take include: number 1, covering cough and sneezes. 2, staying up to date with vaccinations. 3, using gloves, mask, and protective clothing such as PPE. 4, making tissues and hand cleaners available. 5, following hospitals' guidelines when dealing with blood or contaminated items. In summary, the main objective of infection prevention and control programs is to decrease the spread of infections, disease, or healthcare associated infections across healthcare facilities. While healthcare facilities to keep their patients healthy, facilities can become breeding grounds for infections and diseases.